Welcome to This Explainer. Today, we're going to talk about something that's totally changing healthcare. And it's not some new high-tech gadget or miracle drug. It's actually something much, much more fundamental: storytelling.
Let's just start with this question for a second, because it really gets to the heart of this whole field called narrative medicine. The idea here is that what a patient says, and more importantly, how we listen to it, might be just as powerful as any medical test. So, here's how we're going to break this down. First, we'll look at the problem this is all trying to solve. Then we'll dive into what narrative medicine actually is. After that, we'll see how it helps both patients and doctors, how it works in the real world, and finally, what kind of big picture shift it really represents. Okay, let's dive right in. To really get why narrative medicine is so important, you first have to see the gap it's trying to fill. And that gap exists in pretty much every busy modern clinic today. I mean, think about your last doctor's visit, right? Your whole experience probably got boiled down to a checklist for the medical chart. Chief complaint, how long it's been going on, other symptoms. But that list, it completely misses the story. How this illness is affecting your job, what it means for your family, what you're secretly afraid of. All that crucial context just gets lost. So how do we fix that? How do you possibly bridge the gap between that clinical checklist and the actual human being? Well, that's exactly where this art of listening, what we now call narrative medicine, comes in. This was really developed and formalized by Dr. Rita Sharon, and her big idea was that a patient's story isn't just, fluff or background noise, it is essential clinical data. She argued that to be a great doctor, you need two things. You need scientific competence, for sure, but you also need what she called narrative competence. And narrative competence isn't just some vague idea about being nice. No, it's a set of real, tangible skills. It's about listening without jumping in, picking up on the emotional stuff, figuring out the meaning behind the symptoms, and then responding in a way that shows you actually get it. You know the drill, right? The traditional way often starts with a question just like this. It's super direct, it's efficient, yeah, but it also guides the patient to give a really narrow, physical-only answer. But what if we ask something different? Narrative medicine encourages these deeper, more open-ended questions. This totally shifts the focus. It's not just about the what, it's about the how and the why. And questions like these, they create the space for a real conversation to actually begin. And the impact of this simple little shift and how we communicate? Oh, it's profound. This is not just a feel-good thing. It creates this huge ripple effect that actually improves the health of both patients and their doctors. For patients, it really all boils down to trust. I mean, when you feel like your doctor genuinely hears you, you're way more likely to actually follow their advice, to open up about sensitive information you might have kept hidden, and to become a real partner in your own care. And here's a perfect example of the diagnostic power of a story. A doctor might just label a patient as non-compliant. But if they listen to the story, they might find out the real barriers. Maybe the patient can't afford their insulin or they're terrified of needles. All of a sudden, it's not a character flaw. It's a real-world problem you can actually solve together. And I really need to stress this point. This is not about choosing stories over science. Not at all. It's about making our evidence-based medicine even better by enriching it with that invaluable human context. It makes it smarter and more effective.
And hey, it's not just for the patients. This approach can be a powerful antidote to clinician burnout. Think about it. By reconnecting with the human stories at the very heart of their work, doctors can fight back against that feeling of being on a conveyor belt, just treating symptoms. It brings back meaning and purpose. So, this all sounds pretty great in theory, right? But here's the million-dollar question. How can an already swamped healthcare professional actually do this in their day-to-day work without falling completely behind? Well, the good news is it starts with pretty small, intentional changes. It's about asking better questions right from the start. Giving the patient just a minute or two to talk without interrupting, you'd be amazed what comes out. And then just making sure you got it right by repeating their own words back to them. And this right here, this is the key. This really gets at the biggest worry everyone has: time. The goal isn't to make every appointment an hour long. No way. The goal is to make the few minutes you do have more meaningful, more insightful, and frankly, more efficient. Now, of course, we gotta be realistic. This isn't a magic wand. There are some major real-world barriers. The time pressure is immense. Most doctors don't get a ton of formal training in these skills. And it's hard to measure something like trust on a chart,
So when you put it all together, what narrative medicine is really asking us to do is to kind of reframe the entire purpose of a clinical visit, to see it as something more than just diagnosing a problem and writing a prescription. And this is the core shift. It's about moving from being disease-centered to being person-centered. So instead of treating a disease that just happens to be inside a person, you start treating a person who is trying to navigate the incredibly complex experience of having an illness. The focus flips from the pathology to the person.
And this way of thinking completely reframes communication. It's no longer just a soft skill or the chit-chat you do before the real medicine starts. The act of listening, of validating someone's experience. Those words become a powerful part of the treatment itself. And so that leaves us with a final, pretty provocative thought. In our constant push for efficiency in healthcare, seeing more patients, faster and faster, we have to stop and ask ourselves, what essential parts of healing might we be accidentally leaving on the cutting room floor? And really, can we afford to lose them?